this is your love coach Rahul Makin.
I'm great. Namaskar.
This week is the World Immunization Week. Please tell us more about it.
The majority of those deaths were preventable, and that's where vaccines come in. Over 50 years, 154 million children's lives have been saved.
Why should we vaccinate our child?
Vaccines are important, safe for your child, but also for other children. It's that whole investment at the earliest beginning of life.
How do you remember all these numbers on your hand?
We've been in India this year. It's our 75th birthday. What India has is one of the largest public health frontline workforces in the world. The government of India is saying, how can you help us do better and more? And my team is saying, we can do more, we can do better.
Hey guys, this is your love coach Rahul Makin, and as you know, whenever I have a mug in my hand, it's time for our Black Coffee Book Club. But today we have come out of our studio, our own studio, because आज हम book से निकल के थोड़ी बाहर की बातें करेंगे, थोड़ा ground work की बातें करेंगे. As you know, it's World Immunization Week, so today we have in UNICEF's studio, as you can see in the background, Cynthia McCaffrey, UNICEF India's representative. Hi Cynthia, how are you?
I'm great, and namaskar, Rahul.
Wow.
Thank you for the hot coffee. I appreciate it.
Thank you very much for coming to our podcast. How are you doing, and how is India treating you?
Oh my goodness. Well, I'm a little bit nervous because I know that you've got this wonderful podcast, so I want to make sure I do okay. India's treating me extremely well. I'm about a year and a half in. It's a beautiful country. It's diverse, it's delicious, and I've had a chance to travel to most of our 13 field offices. So I've seen a lot of the country, but every day I'm learning something new.
Wonderful. In our podcast, we generally talk about books, we talk about black coffee, but today we definitely are going to talk about one very, very basic thing, which our country really is struggling or has actually come out of, is what we're going to learn from you. I think this week is the World Immunization Week. Please tell us more about it.
So I think I might even go, World Immunization Week is important. I would back up, why is immunization important? That's why we're here celebrating it. Last year, almost 5 million children died before they could celebrate their 5th birthdays around the world. And the majority of those deaths were preventable. And that's where vaccines come in. Because vaccines protect a child from a preventable disease, a preventable cause of that death. So that's why World Immunization Week becomes important, that we look at the importance of vaccinating a child and the progress that we've made in those vaccinating campaigns. And this week tells us it's important to continue investing in it. One of the things with World Immunization Week that's also a little tidbit for people to know is that the expanded program of immunization was started 50 years ago this year.
Oh, wow.
And so that's also a special moment for Immunization Week. So 50 years ago, governments like India, scientists, private sector, UNICEF, World Health Organization, but civil society and non-government organizations came together and said, let's roll out immunizations to protect children early in life from these preventable causes. Over 50 years, 154 million children's lives have been saved, or 6 lives every minute, every year for the last 50 years. So that's the power of the immunization campaign, and that's why we're here this week to say, it works, let's continue to invest in it.
So this week actually needs to be celebrated in its full way. There are a lot of people who are watching us right now who are parents or who are about to become parents. So congratulations in advance. Why should we vaccinate our child? That's one major question which comes. Most of the people would come up with this question that earlier, if we go like 300, 400 years back, there were no, vaccinations invented. So there were lives, people used to live that time as well. So why should we vaccinate our child?
So I think I would say a few reasons, and interrupt me if I go too long, because I'm a good UNICEF bureaucrat. We get into big numbers. One is the power of immunization in protecting, again, against those preventable causes. So I mentioned that last year almost 5 million children had died from before they could celebrate their 5th birthday. Most of the cause is preventable. If you go back to 1990, 12.6 million children around the world died before they could celebrate their 5th birthday. And again, the majority was from preventable causes. So we've gone from 12.6 million in 1990 to just under 5 million. So that just shows the ability to protect our children. And immunization, vaccines have been a huge part of that. The second is coming to India. India has more children and youth than anyone else in the world. The government of India is investing in its young people, including immunizing them. India provides free vaccines, a regimen of 12 vaccines for free to every child, because that's that important. And then the third is, again, picking up on your point about parents-to-be or new parents. Last year, about 26 million new babies were born in India.
Oh.
So that is an incredible, I love thinking about the moments of joy, the new beginnings, but I think that becomes also a genuine incentive of how do we make sure that we protect those young lives with that vaccine. And just the numbers of what we've been able to do around the world to reduce under 5 deaths, and vaccines have been a huge part of that. And you do it because what happens after your 5th birthday? You get to go to school, you get to learn. You then decide what you want to be when you grow up. So it's that whole investment at the earliest beginning of life, not just so you can say I vaccinated, but so that you can get them ready to thrive.
Actually, true. My next question, but before that, it's a question in brackets. How do you remember all these numbers, on your hand?
Oh, it is on my hand. It's UNICEF's bread and butter, and I think I would say I give the government of India huge credit. We've been in India this year. It's our 75th birthday, working with the government of India. And one of the things I love about working in India is India never stops. And when we have incredible partners, Ministry of Health and Family Welfare, Ministry of Women and Child Development, they are constantly asking, what can we do better? What can we do more of? We're doing this. How does it work? And that's coming with their numbers, where they're saying, how are we reaching these children? And then on the other side, just for your audience and your followers, UNICEF is a big old bureaucracy itself. We're 77 years old around the world, 75 years old in India. Just yesterday, I was speaking with my team. They mirror India's energy. And my team, I said, we don't have time to go to this meeting. And they came in at 5:30 at night and said, yes, we do, Cynthia.
Oh.
And I said, well, can you drop something else? And they looked at me in disbelief. Drop what? So I think there's this incredible energy that forces me to keep my numbers, because the government of India is saying, how can you do better and more? How can you help us do better and more? And my team is saying, we can do more, we can do better. So that's a long answer.
So, talking about India, you have been working in India for India for a long time now. What are the major barriers to vaccination or immunization in India? And my second part to the question would be, how can these barriers be addressed?
So one thing I might step back as I've given a lot of those big numbers that are important, because I think it illustrates why immunization and the systems are so important. And as I look at those, we don't build systems for the sake of building systems, but we build systems in order to reach real people with real lives. So just a few months ago, not knowing the podcast was coming, in October, I was in Uttar Pradesh, and I had the chance to visit a health center, and I met a 9-month-old baby, Anasya, and she was there for a vaccine.
Wow.
And she was on track, but getting on track. And I think that's part of the story. So India's investment in its immunization had enabled Anasya and her mother to be there getting a vaccine, but she had been off track. And she was there with the ASHA worker, Sadatri, who had been on this journey with them The baby had been born. The parents were reticent about the vaccines, didn't understand why they're important, were worried about their new baby girl. And she gave them information and knowledge and got them on track. And this was an example that she had now been completely on track with her vaccines. So that's just a picture of both why we build the systems and what the challenges are. India producing the vaccines, so there's enough, but also building the system for the cold chain that delivers it and stores it. But then that investment in the frontline worker, who Sudhatri hadn't given up over these months to make sure that mom and dad understood this is why it's an important investment. And at 9 months, she had gotten Anasya back on track.
Wonderful. I suppose there will be like millions of success stories like this, which we cannot, of course, quote here. Coming again back to India, India being a country where not everybody is privileged enough to get all the vaccines on time, so here comes the role of the government of India and UNICEF India. So how are we helping together, maybe the government of India or UNICEF India, in making all the vaccines accessible to all the kids?
And I think that's exactly where this Immunization Week gets us to shine a light on that story. And I think if you look at what India has done since 1978, when it introduced what we today call its Universal Immunization Program. And as a good bureaucrat, if you read any UNICEF document, it'll say UIP. It stands for Universal Immunization Program.
Oh,
So
wow.
since 1978, the government of India has been investing in the production of vaccines, working with UNICEF, World Health Organization, scientists, private sector to produce those vaccines. We've also worked at how to support a cold chain and making sure that the vaccines can be delivered on time, but also with the proper temperature, and making sure that they get to the hardest to reach villages. Where I was seeing Anasya was in a remote village, a hard to reach place. And yet there was no question that I saw the storage. The storage was there with the vaccines at the right temperature with the
Wow.
cold chain, and a frontline worker, Sudhatri, who was there. What India has is one of the largest public health frontline workforces in the world, with what we call our triple A's, the ASHA worker, the Angawadi worker, and the auxiliary nurse midwife. And India, with support from its universities, from across its ministries, from the state governments, has trained those frontline workers to be able to know what a child needs, the timing of a vaccine, and also to be trusted by the community. So they're in the communities, talking to the communities. So I think it's that system that overcomes those hurdles of what is an immunization, and then once a mother's ready to immunize her child, the supply is ready. India is incredible at that.
Wonderful. So nice to hear it from you. What is that one advice you would love to give to Indian parents who are listening to us, watching us live? Because it's this most prestigious week for us, World Immunization Week. So any advice you would love to give to Indian parents?
So I think I would say 3 things. One is vaccines are important, safe for your child, but also for other children. By vaccinating your child, you're protecting your child from preventable causes of death, but also you're protecting the rest of the population in the school and your community. And if you have questions, ask your doctor, ask your health worker, because they've got knowledge and they're constantly being updated on information. I think the second is to make sure that as you're looking at protecting your child, that it's not just for that moment, you're really talking about their future. So you're giving them that right to the access to a healthy life then and there so that you can get ready for them to thrive. And then the third is it is scary going in. I have 2 daughters who are older and fully vaccinated, boosted up and everything, but it was scary when they would go in. So you can go in with a toy that they hold, and they can have a doll that they like, and even a 9-month-old baby may be hanging onto a blanket. But these are little comforts that you can continue as you're having these visits.
My next question was going to be like this only because this is a podcast for, basically this podcast is meant for kids only, but we haven't asked any question exclusively for kids. So all the kids, if they are watching it, so what would be your advice to them when they go for a shot, they for a vaccine? Because they are really afraid of the doctor. Whenever they see a person in white apron, they
Yeah.
say, okay, he will put some injection into my vein. So I'm really frightened. So what is your advice to those kids? What do they do?
First of all, you're not alone. I'm also scared of the doctor in the white coat because usually if you're at the doctor, you're thinking, oh, there's something wrong. I'm sick. I don't feel well. So you're not alone. Even adults are scared. I think the second is remember that we often go to the doctor for preventive care, for a checkup. Every year I go for my checkup, you go for your checkup. So remember that as well. And so it's okay to be afraid, but remember doctors are also trying to get ahead of making sure that you don't get sick. And third, talk about it, or bring that toy or that blanket, or tell your mom, your caregiver, your doctor, I'm scared. And they will tell you it's going to pinch, or this one won't hurt at all. And so ask for information. It's okay for you to ask what's going to happen, how am I going to feel afterwards, and get ready for it. That's you have as much right to understand what's coming as your mom or dad.
And my only suggestion would be you could actually bribe your kids. Okay, after the vaccination, you'll get some softie of your of your choice, or maybe a candy, whatever you like, or maybe a new toy. So yes, you can bribe them
Yes.
this way, maybe if it works.
It works for me. Yeah.
So as it is a podcast about books, my last question to you would be a little different from vaccinations or immunization. You seem to be a super learned person, a person who must have read a lot of books. One book while growing up, which changed your life or your outlook towards life, which you still recommend to others. You should definitely read this, or maybe which helped you in doing what you're doing right now.
Oh, that's a great question, and should have been ready because I've seen this coming. So I love to read, but I have to say one thing that I would also say is you always see read with your kids, and we read with our kids, my husband and I, and they are much better readers than I am. So it does pay to read with your kids from the very beginning. I think there would probably be almost 3 books that I would mention. So one is, I'm from the United States, so it may be very American, but a book that I loved was To Kill a Mockingbird,
Oh, I love that.
which is also a good movie. So you can
Yes.
read the book first, kids, before you watch the movie. But I think it gives a very, it shows a very difficult time in the United States. So I like the novel that shows hard, ugly things about society, but also shows the incredible strength of humanity to kind of see good in people and try to understand them. So that was a powerful book, and it's a short one. I think a second one that I really enjoyed was The Poisonwood Bible, which is just a fascinating book about family and challenge and traveling. And then the third book it's a double whammy. David Copperfield, which is a fantastic book that our daughter loved. And then I've read the new book that riffs on it, Demon Copperhead, which is also, it's a modern American version of David Copperfield. And again, it shows humanity and all of the things that we go through. And I think it's good with immunization and vaccines. These are
Absolutely.
painful moments, but humanity overcomes them.
Wonderful. So, Cynthia, it was lovely having you here in our podcast, and I truly enjoyed it. Although, I had thought, beforehand that it's going to be very data-heavy podcast, but you made it so light, you made it so conversational. I really loved it, enjoyed it, and especially all the fun part of it was wonderful. And it's very important. World Immunization Week is going on. To have your kids lead a wonderful life, so that they thank you later once they grow up as adults, that our parents have really helped us during our childhood. You need to get them all those vaccine shots which are actually given by the government of India, all the list. So please go by them and abide by all the vaccine shots what have been prescribed, and It's very important. Last words from you, Cynthia?
I would just say thank you so much for all you do to communicate the mission like immunization, but also just talking to kids about what they should know, what their parents should know. And if you had time, I could go through all the data that you have.
Thank you.
But thank you for the chance to meet you in person and for all you do for us and for getting information out there for kids.
Thank you very much.
Thank you.